I'm Dr. Rehan from Hyderabad, and I finished my general surgery from Andhra Pradesh Chittoor Government College. So I have been exposed to many open surgeries, sir, and even the laparoscopic surgeries. But doing the surgeries without knowing the basic knowledge was very difficult. So after coming here, what is my main motto was to go into the evolutionary surgery, not a basic open surgery. So what it is presently, everything is like technology is upgrading one by one. Still, we should not be back behind with a just open surgery. That was the main motto. Not only like laparoscopy surgery, I am interested in robotics and laser also. So before going to that, what was my main motto was to learn about the basics about the laparoscopy surgery, how things are going upgraded. So in my hospital, like where I got my graduation done, there laparoscopy surgeries were done, and we know what the procedure about how lap chole should be done and how umbilical area will be done, but we don't have the basic knowledge. After coming here, I've seen many lags in myself only, like okay, this how to keep the various needle, how to keep the port, and what are the exact positions, why, when, and how, where, what this one energy source should be used, and everything. So, and like this one cases are also like if there was no live OT, we might have lagged with the only knowledge. That also I have seen a lot of difference in ourselves. But overall, like you are very cooperative, and thank you so much, sir. Like I'm very confident that if I go into the OT, I can handle the case. I have that confidence.
Thanks.
Thank you so much.